Botox is like a magic wand in a physician's hand. Wherever you want the wrinkles to be gone, you just do that and they're gone. It's as simple as that. Tiny little injections to the region of the wrinkles and they are just gone in just a matter of 4 days to 7 to maximum 10 days, and they just don't come back for the next at least 3 to 4 months. Then you need to come back for a little top up. What are the indications for Botox? Plenty. Commonly we only think probably Botox is for frown lines or for lines when you laugh. But you must also know that Botox works on many lines. Starting right from the top of your face, you could erase your forehead lines, which are not really necessary, frown, which definitely our families will be happy without us having that expression. Laugh lines, which sometimes really crinkles your face up and makes your eyes look really small. Under eye, some people have a little bulge. When you laugh, your eye becomes really chinky. So that part of it, you can relax that muscle to give you a nice, wide-eyed, happy smile. You could use Botox along the jawline, which is very popularly called Nefertiti lift. So it gives you a nice lift by completely easing off this muscle which pulls your face constantly down. You could also give a bit of a Botox to the corner of your mouth, which is a muscle called DAO, which pulls you down. Most of us look sad in some of our photographs. So you knock it and then you don't look so sad. They could also be done for things like a poppy chin. That looks pretty bad at times when you're talking and expressing. So when you give a bit of Botox there, combine it with a little filler, you could have a nice rounded chin. You could also give Botox for the smoker lip lines. You could Botox for the flary nostrils. You could Botox to lift gently the tip of your nose. They could also use the same drug to get rid of your bunny lines there. So Botox has various indications along with treating your hyperhidrosis, which is excessive sweating, and also your migraine headaches. For most of our injectable procedures or for microneedling, the anesthesia that we usually use is a surface anesthesia, which is just a cream that we apply. We will apply this Numby cream for some time, for almost an hour, remove it, and the patient is pretty much numb and takes any procedure that you do really well. This is a very simple injection.
Botulinum toxin type A blocks acetylcholine release by cleaving SNAP25, a cytoplasmic protein that is located on the cell membrane and that is required for the release of this transmitter. The affected terminals are inhibited from stimulating muscle contraction. The toxin does not affect the synthesis or storage of acetylcholine or the conduction of electrical signals along the nerve fiber. Evidence indicates that chemical denervation of the neuromuscular junction by botulinum toxin type A results in an expansion of the end plate region and growth stimulation of collateral axonal sprouts. A nerve sprout eventually establishes a new neuromuscular junction and muscle activity gradually returns. Recent research suggests that this new nerve sprout eventually retracts as the original junction returns to functionality. The sprouts disappear and the original end plate returns to full activity. In either case, repeat injections of Botox purified neurotoxin complex may be required to maintain the desired clinical effect.
And last, but definitely one of the most popular things I'm asked for is open pores. One magic solution for open pores is to give tiny little diluted Botox along your cheek to make it look tight and glossy and beautiful like a movie star. Botox is one magic drug which was introduced to us. Thanks to Allergan, you can now erase all those wrinkles right away and have a fresh looking skin. Erase off those unwanted expression lines. This is how a patient would look after we have injected them immediately. There would be little blobs which is going to settle down in the next 10 to 20 minutes max. been often asked whether Botox and fillers are the same. No, they are not. Botox is a protein which acts by relaxing your muscle, so more given to the lines that come on action or expressions that come on action. Also, you give it to kind of counteract certain negatively pulling muscles or muscles which pull you downwards, so you can achieve a very fresh look, a facelifted look, a younger look, and a smoother look. Whereas filler is mostly made up of AHA. There are also other fillers like calcium hydroxyapatite, PMM, a whole load of materials. But the most popular one is hyaluronic acid. And that's very versatile also. You could use them for lines, you could use them as fillers, you could use them into the lip, volume enhancers, under the eye, so on and so forth. So that's very versatile to play with and to achieve really smooth results with not much of downtime. There are a lot of times that people come to us saying that there's a really heavy jaw or we have a broad lower face. But there are a lot of times people also come and say, Doc, when I take a long photograph or a full-length photograph, I look fine. But when you take a mug shot, I seem to look like I have a huge body below me, though I look slim. That's only because your face looks really fat. It could be the fat component, it could be the muscular component. If it is the muscular component, then this kind of injection, when we give a little bit of Botox along your masseters, works wonderful. It just tapers your face within a month's time, and then everybody starts asking you, wow, have you lost weight? And that's all. Nobody really makes out that you've done something.
I always felt conscious about my jawline. It was very broad and sharp, and as a musician and someone who needs to be in the public eye, I always felt like I needed to cover it up. Directors while shooting on sets and photographers on photo shoots always asked me to cover up my jawline with hair. I knew that there were medical procedures to improve my jaw, but I was always worried about what the effects would be. But I don't worry about my jawline being too overpowering anymore, and that's all thanks to Dr. Rashmi Shetty and her team. She introduced me to this pain-free procedure and recognized that I was a good candidate for it. Her aesthetic eye meant that she gave me the desired cut on my jaw, not too less and not too much. This has allowed my jawline to become more oval and keep symmetry in my face. The results have been brilliant. And now I can experiment with different hairstyles, and I don't need as much makeup or contouring to cover up and shade my jawline.
What we are now going to do is Botox for a heavy jaw or a hypertrophic masseter. This is one of the muscles among 4 other muscles that you would use to chew. This was more used when we had to chew the raw meat or to tear the meat. So right now, it's not that it is so necessary for us, but there are some people who really have it hypertrophied or bulkier right from the beginning. There are some who have this condition all along, but there are some who develop it because somebody told you chewing gum makes your facial muscles better. That is not true. All it makes is this bigger. We all want a nice tapering lower half of your face, or then a very well chiseled square jaw, but not something which is bulging slightly. We are going to just make this a little softer to suit her face. Her chin is a little narrow, therefore I'm not going to cut this off completely because that may not look good that much. I'm just going to ease this off to then suit the rest of her face. I'm going to do a little simple marking which is going to make my injections easier. Just clench. Okay, this is the anterior border of my muscle. This is the angle of my muscle. All right, this is the most prominent of her space. This is how it is. As soon as the injection, you won't see anything. Absolutely nothing at all. The only post-care injection would be that I would ask my client to keep biting for the next 1 or 2 hours so that the muscle action keeps on, and that's about it. If at all, you may face a little headache the next morning, and that's because of your chewing and not because of the injection. The action goes on to take place slowly and slowly. In the next 15 days, she will have comments of people saying, wow, you've lost some weight. Thereafter, in 1 month, it really achieves the maximum result it has to achieve. And then you decide whether you want to top it up a little more and just let it be. And after 5 months, you redo it. Then the result lasts pretty much for a year after that.
I've always believed that it's great to feel confident and be happy with what you have, but there's no harm with a little help on the way. My help was Dr. Shetty and her team and her treatment. So thank you all once again.
Hyperhidrosis can be just a small irritation with a little excessive sweating that could stain your most favorite designer clothes, or could be a huge social embarrassment where even shaking hands can be a huge embarrassment to a person. So hyperhidrosis, whether it is underarms, palms, your soles, can now be treated without the earlier solution which led to compensatory hyperhidrosis elsewhere. Botox is a very, very simple solution, literally a 1-minute procedure which gives you freedom from this excessive sweating from 4 months to almost a year. So let's now see how simple the whole procedure is and also painless. What we are doing now is raising small blebs between his skin with Botox. If you see, there's hardly any bleeding, or rather no bleeding, and these tiny blebs disappear in the next 10 minutes. No downtime, no compensatory hyperhidrosis anywhere. He is sweat-free for the next 4 months to almost a year.